Greetings. Welcome to our channel Ethiopian Joy. Today our presentation is on signals that you may have heart disease. Heart disease refers to a group of conditions that have impact on heart. Heart disease leads to heart attacks. Heart attacks can be brought on through clogged arteries, thickened heart walls, and other causes. People are not often aware of the early warning signals and symptoms that may indicate a heart disease. Being aware of these early signs can help to detect a heart problem early. One, chest pain or pain in upper extremities. Chest pain can show up as a tightness, numbness, tingling sensation, or other type of discomfort. Pain with the heart shows up in upper body pain, arms, backs, neck, jaw, shoulders, lightheadedness, cold sweat, face drooping, speech difficulty, anxiety, and abdominal pain. Any chest pain or related pains that we have discussed should be seen by a doctor. Fatigue. Fatigue is one of the most common symptoms of heart failure. Fatigue is present in people who have heart problems because the heart is not pumping as much blood throughout the body. Some activities like climbing the stairs, walking may be very difficult for people who experience such a situation. Shortness of breath. Shortness of breath can be a sign of a poorly functioning heart. If you find yourself having trouble catching your breath or feel out of breath for no apparent reason, it's time to visit your doctor. Heart palpitations. A heart palpitation is the feeling of your heart skipping a beat, and it can be a common problem. If you have persistent palpitations alongside other symptoms such as dizziness, fainting, or chest pain, it's important to consult with a medical doctor. Heart rates such as persistent increase or decrease are also warning signs of possible heart problems. Edema. Edema is swelling in different parts of the body, another possible sign of heart disease. It occurs because the heart is not pumping well and blood vessels begin leaking fluid. It usually shows in swelling of the feet. Again, it helps to consult your doctor. Coughing and wheezing. If cough is ongoing, and it's especially bad when someone is laying on his or her back, it's time to see your doctor. A cough that occurs more often when in bed or laying down is a cause of concern. And it should not be just taken as cold or flu. Sometimes it can be more serious. Dizziness. If the heart is not functioning well, it can cause a decreased blood flow to the brain, which is often why people with heart problems experience dizziness or fainting. Frequent or unexplained dizziness should always be examined by a medical doctor. Nausea and vomiting. Heart attacks often can start with signs that most people ignore and attribute to indigestion, anxiety, or something else. Early signs of a heart attack can include nausea, sweating, and chest discomfort, and it should not be put off and treated as an emergency situation. Some people have reported experiencing these symptoms in the weeks leading up to heart attack. A family history of disease, heart disease. It's important to know your family history in terms of heart disease. If you know that you have a history of heart disease in your family, it's a good idea to have regular checkups with your doctor. You also need to practice healthy lifestyle choices. High cholesterol or high blood pressure. Both high cholesterol and high blood pressure put you at higher risk of developing a heart disease. Therefore, you should have your cholesterol and blood pressure checked regularly by your primary care physician and learn how to lower both of them. Like all other health problems, early detection of heart disease gives you a much better chance at recovery. It is very integral to your overall health. Pay attention to your health, notice changes to your body, and be aware of the early warning signs or signals of heart disease. Take care and be well.